If you have these health issues, using olive oil could actually make things worse. Did you know that certain health conditions can turn this popular kitchen staple into a hidden danger? I've spent hours uncovering the unexpected risks of olive oil, and the results might surprise you. So, why do some doctors warn patients to avoid it? Stay with me as I reveal which health conditions make olive oil more harmful than helpful. This is information you won't want to miss because it might just apply to you or someone you love. Let's get started. Let's begin with pancreatitis. My friend, if you or someone you know suffers from pancreatitis, it's crucial to be cautious about olive oil consumption. You see, olive oil, despite its many benefits, is a high-fat food. While healthy fats are essential in our diet, they can be problematic for those dealing with pancreatitis. Here's why. The pancreas plays a key role in digesting fats by producing enzymes. When you consume high-fat foods like olive oil, your pancreas is stimulated to produce more of these enzymes. For someone with a healthy pancreas, this isn't an issue. But for those with pancreatitis, this extra demand can lead to inflammation, exacerbating the condition and potentially causing significant discomfort or even a flare-up of symptoms. It's a delicate balance. On one hand, olive oil is celebrated for its heart-healthy monounsaturated fats, but on the other, these very fats can be a double-edged sword for individuals with pancreatic issues. If you're managing pancreatitis, it might be wise to limit your intake of high-fat foods, including olive oil, or consult your healthcare provider for personalized advice. This way, you can enjoy the benefits of olive oil without risking your pancreatic health. After all, staying informed and mindful of how our bodies react to certain foods is a powerful step toward better health. Now let's talk about gallbladder problems. If you've ever dealt with gallstones or gallbladder disease, you know just how uncomfortable, even painful, these conditions can be. Here's the thing, my friend. Olive oil, while often praised for its health benefits, can pose challenges for those with gallbladder issues. Olive oil is rich in healthy fats, which, under normal circumstances, are great for your body. But when you consume these fats, your gallbladder is prompted to release bile to help digest them. For someone with gallstones or a compromised gallbladder, this process can lead to significant discomfort. The bile, trying to break down the fats, might not flow as smoothly if there are stones obstructing the way. This can result in sharp pain, especially after meals rich in fats like olive oil. It's a bit of a catch-22 because while olive oil is a staple in heart-healthy diets, it can be tough on your gallbladder if you're already dealing with issues. So what's the takeaway? If you have gallbladder problems, it's important to monitor your intake of fatty foods, including olive oil. You might need to limit these foods or choose lighter options that are easier on your system. As always, it's a good idea to talk to your healthcare provider to figure out what's best for your specific situation. Taking these steps can help you avoid unnecessary pain and keep your digestive system running smoothly, allowing you to enjoy your meals without worry. Next, let's dive into gastroesophageal reflux disease, GIrd, a condition that many people struggle with daily. If you're familiar with that uncomfortable burning sensation in your chest after eating, you might be dealing with GIrd. Olive oil, despite its many virtues, can sometimes be a culprit in aggravating this condition. Here's why. Olive oil has the potential to relax the lower esophageal sphincter, LES, that crucial valve that separates your stomach from your esophagus. When the LES relaxes too much, stomach acid can flow back up into the esophagus, causing that familiar and unpleasant heartburn sensation. For those with GIrd, this means that consuming olive oil, especially in large amounts, might trigger or worsen acid reflux symptoms. It's a bit ironic, isn't it? Olive oil is often lauded as a healthy fat, yet it can lead to discomfort if you have GIrd. This doesn't mean you need to completely eliminate olive oil from your diet, but rather, it's about moderation and awareness. You might find that smaller quantities of olive oil, perhaps used as a light dressing rather than in cooking, are easier on your digestive system. If you're prone to acid reflux, paying attention to how your body reacts to different foods, including olive oil, is key. And remember, it's always helpful to have a chat with your healthcare provider to tailor your diet in a way that supports your health without compromising on comfort. After all, feeling good after you eat is just as important as what you eat. Let's move on to allergic reactions, a concern that, while rare, is still worth noting. Olive oil is generally considered a safe and beneficial ingredient in both our diets and skincare routines. However, for a small number of people, it can trigger allergic reactions. These reactions might manifest as mild symptoms, such as skin rashes or itching, particularly when the oil is applied topically. But in more sensitive individuals, the reaction can be more severe, leading to respiratory issues like difficulty breathing, or even anaphylaxis, a life-threatening condition that requires immediate medical attention. If you suspect you might be allergic to olive oil, it's important to proceed with caution. Doing a patch test before applying it to large areas of your skin or monitoring how your body reacts when you consume it can help identify any adverse reactions early on. And as always, consulting with an allergist or healthcare provider is a smart step if you have any concerns. While olive oil offers many health benefits, it's crucial to listen to your body and take any signs of an allergic reaction seriously. Now let's discuss hypotension, or low blood pressure, and how olive oil might influence it. Olive oil is well known for its ability to support heart health, in part by helping to lower blood pressure. For many, this is a positive effect, but if you already suffer from hypotension, it could be problematic. Consuming olive oil, especially in significant amounts, can potentially lower your blood pressure even further, leading to symptoms like dizziness, lightheadedness, or even fainting. If you have low blood pressure, it's important to be mindful of how much olive oil you're incorporating into your diet. While you don't necessarily need to avoid it altogether, moderation is key. Keeping track of your blood pressure levels and how they respond to certain foods, including olive oil, can help you manage your condition more effectively. And of course, discussing your diet with a healthcare provider can provide additional guidance to ensure that you're making the best choices for your overall health and well-being. Remember, the goal is to enjoy the benefits of olive oil while keeping your blood pressure at a safe and stable level. Now let's talk about high-calorie content, an aspect of olive oil that often gets overlooked. Olive oil, for all its health benefits, is also very calorie-dense. Just 1 tablespoon of olive oil contains around 120 calories, which can add up quickly if you're not careful. This might not seem like much at first, but if you're someone who's struggling with obesity or trying to manage your weight on a calorie-restricted diet, these extra calories can be significant. My friend, it's easy to go overboard with olive oil, especially when you're pouring it over salads, cooking with it, or using it as a dip for bread. The problem is, while olive oil is a healthy fat, consuming too much of it can lead to weight gain, which might counteract some of the health benefits you're aiming to achieve. It's a classic case of too much of a good thing can be bad. So what's the solution? Portion control is key. Instead of pouring directly from the bottle, try using a measuring spoon to keep track of how much olive oil you're actually consuming. You might also want to consider using a spray bottle to lightly coat your pans or salads, which can help you enjoy the flavor and benefits of olive oil without overdoing the calories. By being mindful of your intake, you can still incorporate olive oil into your diet in a way that supports your health goals, without the unwanted side effects of weight gain. Balance is everything, and with a little attention to detail, you can make olive oil work for you, not against you. Let's turn our attention to kidney disease and how olive oil might interact with it. Olive oil is generally celebrated for its heart-healthy monounsaturated fats, but it's important to remember that it also contains a notable amount of potassium. For most people, potassium is a crucial nutrient that supports heart function, muscle contraction, and nerve signaling. However, for individuals with kidney disease, managing potassium intake becomes a delicate balancing act. When the kidneys are not functioning properly, they struggle to filter excess potassium from the blood. This can lead to dangerously high levels of potassium, a condition known as hyperkalemia. Hyperkalemia can cause serious health issues, including irregular heartbeats or even heart failure. For those on potassium-restricted diets due to kidney disease, even healthy foods like olive oil need to be consumed with caution. To navigate this, it's essential to monitor the amount of olive oil and other potassium-rich foods in your diet. This doesn't necessarily mean eliminating olive oil entirely, but it does mean being mindful of your overall potassium intake. Consulting with a healthcare provider or a dietitian can help ensure that your diet remains both nutritious and safe, taking into account your specific health needs. In this way, you can continue to enjoy the benefits of olive oil without compromising your kidney health. Now let's explore how digestive issues can arise from excessive consumption of olive oil. Olive oil is often praised for its numerous health benefits, but like anything, too much of it can lead to problems. One of the most common side effects of consuming large amounts of olive oil is digestive discomfort. For some, this can manifest as bloating or even diarrhea, particularly if their digestive system is on the sensitive side. Olive oil is a natural laxative, which means that while a small amount can help keep things moving smoothly through your digestive tract, overdoing it can have the opposite effect. When consumed in excess, olive oil can accelerate bowel movements more than intended, leading to loose stools or diarrhea. This can be especially problematic for those with sensitive stomachs or conditions like irritable bowel syndrome, IBS, where the digestive system is already prone to being easily upset. To avoid these unpleasant side effects, it's important to incorporate olive oil into your diet in moderation. Start with small amounts and see how your body reacts before increasing your intake. If you notice any discomfort, it might be worth scaling back. This approach allows you to enjoy the benefits of olive oil, such as its anti-inflammatory properties and heart-healthy fats, without the risk of digestive disturbances. Remember, balance is key to making the most of this nutritious oil while keeping your digestive system happy and healthy. Let's talk about why choosing extra virgin olive oil is the best option. Extra virgin olive oil, EVOO, is the least processed form of olive oil, which means it retains more of the natural antioxidants, vitamins, and healthy fats that give olive oil its renowned health benefits. Unlike refined oils, EVOO is extracted through a cold pressing process that preserves its nutrients and rich flavor. This makes EVO not only a heart-healthy choice, but also a powerful antioxidant source that can support overall well-being. By choosing extra virgin over other types, you're ensuring that you're getting the purest form of olive oil, maximizing the health benefits with every use, whether in cooking, dressings, or dips. Incorporating olive oil into a balanced diet is a smart and delicious way to boost your health, particularly when following a Mediterranean-style diet. This approach to eating is celebrated for its heart protective benefits and its ability to reduce the risk of chronic diseases. By using olive oil as your go-to fat, whether drizzled over fresh salads, blended into dressings, or lightly used for sautéing, you're adding a powerful dose of healthy monounsaturated fats and antioxidants to your meals. If this was useful, don't forget to like it and share it on WhatsApp with your loved ones. To take your diet a step further, it's beneficial to combine olive oil with other healthy fats like avocado, nuts, and seeds. This mix not only adds variety to your meals, but also ensures you're getting a balanced intake of different fatty acids. Each of these foods brings its own unique set of nutrients, which together support heart health, improve cholesterol levels, and provide essential vitamins and minerals. When it comes to cooking with olive oil, it's important to use it at safe temperatures to preserve its nutritional value. Olive oil shines best when used at moderate heat levels. Think sautéing or baking. This helps prevent the breakdown of its beneficial compounds, such as healthy fats and antioxidants, which can degrade at higher temperatures. By keeping the heat in check, you can enjoy all the rich flavors and health benefits that olive oil has to offer, making it a valuable and versatile part of your everyday diet. When it comes to monitoring blood pressure, particularly for those who struggle with low blood pressure, it's important to be mindful of how much olive oil you're consuming. While olive oil is known for its heart-healthy benefits, it can also lower blood pressure. If you already have low blood pressure, increasing your olive oil intake could potentially lead to dizziness or fainting. Keeping a close eye on your blood pressure levels as you incorporate more olive oil into your diet is essential, and consulting with a healthcare provider can offer personalized guidance to ensure that you're staying within a safe range. Similarly, the safe use of medications is crucial, especially for those taking blood thinners or other medications. Olive oil has mild anticoagulant properties, which can enhance the effects of blood-thinning medications and increase the risk of bleeding. Before making any significant changes to your olive oil intake, it's advisable to discuss it with your healthcare provider. This way, you can enjoy the benefits of olive oil without inadvertently interfering with your medication regimen. For those with sensitive digestive systems, it's best to approach olive oil with caution. Gradual introduction for sensitive stomachs can help minimize the risk of digestive discomfort, such as bloating or diarrhea. Start with small amounts and observe how your body responds before increasing your intake. This gradual approach allows your digestive system to adjust, ensuring that you can enjoy olive oil without any unwanted side effects. Lastly, understanding the daily recommended intake of olive oil is key to balancing its health benefits with your overall calorie intake. Generally, 1 to 2 tablespoons per day is sufficient for most people. This amount provides the heart-healthy fats and antioxidants your body needs without contributing to excessive calorie consumption. By sticking to this guideline, you can make the most of olive oil's nutritional properties while maintaining a healthy, balanced diet. Thanks for watching, and take care of your health.